done. I want to thank everyone for joining us today. The theme of today's presentation is in-house versus outsourced CCM, or chronic care management. We will explore effective strategies for integrating chronic care management into clinical practice. But this is a very special webinar because there are two different sessions. One focused on chronic care management, which will explore whether it is feasible or more feasible to start your own in-house program or outsource it to a vendor for a particular practice, as well as another presentation led by Mr. Ikram Masabini, which will focus on AI as well as IT and security. Because obviously, if you're going to start one of these programs, you want to consider the impact of security and technology in keeping people's data safe. With that being said, as healthcare professionals, you know how important it is to provide continuous care for patients who are living with chronic conditions while making the most of technology used to monitor their health remotely. This approach can improve outcomes, enhance patient engagement, and actually help to manage a clinic's workload more efficiently. Throughout the session, we'll explore practical methods to implement these programs effectively while leveraging platforms, remote monitoring devices, and the roles that your care team can play in coordinating care. By combining these elements thoughtfully, we can deliver comprehensive care that supports both patients and providers in managing chronic diseases more effectively. In this presentation, there are four objectives that we will address for today's webinar. When deciding between in-house and outsourced chronic care management and remote patient monitoring models, it's always important to consider the specific staffing, technology, as well as documentation requirements that will ensure reliable execution. Because in-house models typically require a dedicated clinical staff trained in chronic care management protocols, alongside integrated technology platforms that can support the seamless data sharing as well as patient communication. Whereas outsourced models, on the other hand, rely on external vendors who then provide both the technology and the specialized personnel, which can be advantageous for practices with limited internal resources or those looking to scale rather quickly. We'll also look at launching a successful pilot in the first 30 days, which really requires defining a clear patient cohort that fits your practice's goals and capabilities. Then establishing straightforward workflows that balance patient engagement with clinical oversight. It's crucial to implement these processes early on because they can support compliance with regulatory standards, enable accurate reporting, and foster continuous quality improvement. So, the session today aims to give you a clear, practical steps to implementing chronic care management and even remote patient monitoring in your clinical practice in ways that really work. So, I want to take a moment and thank you for your support in joining us today. I want to thank Mr. Ikram Masabini for his company attending this webinar and the second portion of the webinar, which will focus more on AI and IT and security. So our focus for this particular presentation is to bridge the gap between value-based care models you know about and the daily workflows in your respective clinic, so that these approaches can become a part of your routine patient care. My name is Dr. Cedric Bachitu. I am the founder and CEO of Chronic Care, and I bring extensive experience in our unique pharmacist-led chronic care management approach to guide you through this process. Let's start with a brief history lesson. In 2020, the Centers for Medicare and Medicaid expanded access to care management programs by allowing specialty practices to participate. This is important because it broadens the reach of these services beyond primary care practices. Despite this, current data shows that less than 10% of Medicare enrollees are actually enrolled. Excuse me. Less than 10% of Medicare beneficiaries are actually enrolled in these programs, highlighting ongoing challenges in adoption. Over the years, fee-for-service payments have decreased while value-based care reimbursements have gradually increased, reflecting a shift towards rewarding care quality. CMS has also introduced several programs, excuse me, CMS has introduced several programs to support chronic care management. For example, in 2015, the Chronic Care Management Program was launched to help patients with two or more chronic conditions. By 2019, standalone reimbursement became available for remote patient monitoring, which uses technology to track patient health remotely. And in 2020, the Principal Care Management Program was created specifically for patients with only one condition, filling a gap in support. Chronic conditions are responsible for the vast majority of our healthcare spending in the United States, with 90% of costs linked to these ongoing health issues and over 80% of Medicare patients living with at least one condition. They account for 75% of death nationwide. Excuse me. To address this, the healthcare system is moving away from paying for volume and shifting towards value-based care. This new approach focuses on prevention and coordinated care in order to improve patient outcomes while controlling cost. Programs like chronic care management and remote patient monitoring play a key role in this transition, helping to stabilize finances by reducing hospital readmissions and improving chronic disease management. Clinics that successfully implement these models can also earn additional revenue by demonstrating exceptional performance in managing chronic conditions. Chronic care management, otherwise known as CCM, acts as a foundation that allows you to add other valuable services like remote patient monitoring or RPM, which together improve patient care and support your practice's financial stability. CCM lets you document the time you spend managing patient care according to CMS guidelines, generating CPT codes based on that time, excuse me, which helps ensure your efforts are reimbursed. This approach keeps patients engaged between their in-person visits with their doctors, allowing your team to provide ongoing support. With remote patient monitoring, you can remotely track your patient's vital signs like blood pressure or even oxygen levels, helping to spot potential health risks earlier. This proactive monitoring and patient outreach leads to better clinical outcomes by identifying complications before they can escalate. Research has shown that chronic care management helps reduce emergency room visits and hospital readmissions, highlighting its role in preventing avoidable complications. Together, these programs create a more connected and efficient way to manage chronic care while supporting your patient's financial health, your practice's financial health, and your patient's health outcomes. Remote patient monitoring or RPM, allows healthcare providers to continuously track their patients' health data, including blood pressure, glucose levels, or even heart rate in real time. This ongoing monitoring supports earlier interventions by identifying potential problems before they can escalate, which is especially important for managing chronic diseases. The devices shown here, like blood pressure cuffs and glucose monitors, are examples of the technology patients use to collect and transmit that data. The first table breaks down how billing works for chronic care management. It reimburses $60.49 for the first 20 minutes, $45.93 for an additional 20 minutes, and another $45.93 for an additional 20 minutes of care, culminating in a total of 60 minutes of care. These payments are based on the time spent by clinical staff with patients or caregivers. These time increments correspond to specific CPT codes, including 99490 and 99493. For complex cases of chronic care management, reimbursements are $131.65 for 60 minutes of time spent with patients and $70.52 for an additional 30 minutes of time spent with patients or their caregivers. These time increments correspond to CPT codes 99487 and 99489. On the right side of the table breaks down how billing works for remote patient monitoring services, starting with initial enrollment reimbursing about $20, then monthly monitoring for around $43, and additional payments based on the time spent by clinical staff with patients or their caregivers. These time increments correspond to specific CPT codes and help practices capture additional revenue while providing valuable continuous care. When combined with chronic care management, remote patient monitoring contributes to better health outcomes and offers a practical way to increase revenue based on billable time spent managing patient care. The projected earnings emphasize how these services can scale. Excuse me. This shows revenue potential from just one patient compared to revenue potential for up to thousands, demonstrating the financial impact alongside improved patient health management. When considering how to implement chronic care management and remote patient monitoring in your practice, it's essential to strike a balance between maintaining in-house control over processes and leveraging outsourcing to achieve speed and scalability. Start by evaluating whether your organization is ready and able to invest in the necessary technology to manage these programs effectively. Evaluate how many patients require support, excuse me. Evaluate how many patients require support and evaluate whether your organization is ready and able to invest in the necessary technology to manage these programs effectively. Take a close look at how many patients require support. If the volume is manageable, an in-house solution may work well, but larger patient populations might demand scalable solutions through outsourcing. Also, assess your team's current capacity and expertise. Do you have enough trained staff to handle chronic care management and remote patient monitoring operations internally? Or maybe it would be more efficient to partner with an external provider. This balance will ultimately impact your ability to deliver quality care efficiently without overextending your resources. The in-house model helps build your internal team's skills and expertise over time, which is essential for maintaining high quality care within your practice. It also integrates deeply with your existing electronic health record systems, so data flows smoothly and you can avoid disruptions or extra work. Importantly, it keeps you in full control of your care processes and how you engage with patients. This means you can tailor your workflows and patient interactions in a way that best suits your practice's unique needs, supporting both autonomy and stronger continuity of care across all stages. There are also challenges with the in-house model. Scaling up your chronic care management and RPM programs quickly can be challenging without investing significantly in the necessary infrastructure and personnel. Complex documentation requirements and compliance requirements can add to your workload, making it essential to have staff who are well trained in chronic care management and RPM processes, as well as documentation standards. This preparation can help avoid bottlenecks and workflow complications early on, ensuring smoother implementation and sustainable growth. Partnering with external experts in chronic care management and remote patient monitoring can allow your practice to integrate these programs quickly without disrupting your existing workflows so your team can stay focused on patient care. These vendors handle complex billing and compliance tasks, which help keep your operation costs predictable and manageable. Additionally, turnkey staffing and reporting services provided by these partners make launching new programs much faster, reducing the burden on your internal resources. Excuse me. To achieve successful program outcomes and maintain accountability, it's essential that everyone involved agrees on the goals from the start. When your clinic staff and vendor teams work together, clear roles and expectation help prevent communication gaps that might otherwise slow progress or even cause confusion. Additionally, because patient data is sensitive, strong measures must be in place in order to protect patient privacy and security whenever information is being shared. This means establishing protocols that meet regulatory standards and ensuring all parties understand their responsibilities for handling data carefully. By focusing on clear roles and thorough data integration, we can create a smoother collaboration that supports patient care without risking security or clarity. And Mr. Ikram will give us more insight into sharing data and protecting privacy, why that's important. When deciding between in-house model or outsourcing or even hybrid models for chronic care management and remote patient monitoring services, it's important to match the approach to your practice's size and its needs. Larger healthcare systems and have typically have larger care teams, and they often benefit more from an in-house model because it offers full control and allows for deep integration with their existing systems, which supports more customized workflows. Smaller practices, including independent practices, might find an outsourced model to be more suitable since it allows for quicker setup and provides predictable cost, reducing the overall burden on internal resources. The hybrid model splits responsibilities between internal staff and external partners, combining the advantages of both approaches to balance control with scalability. An example of this might be a practice which chooses to lead its own efforts for remote patient monitoring while outsourcing chronic care management to an external vendor. Choosing the right model depends on your organization's readiness, available resources, and goals that you have, ensuring that you maintain an effective workflow while supporting patient care efficiently. For successful chronic care management and remote patient monitoring, programs, strong cooperation is required among all roles uh, involved in order to keep operations running smoothly. Designating a chronic care management champion can be very effective. They can take care of overseeing all program activities, and they can serve as the internal leader for troubleshooting and even managing day-to-day tasks associated with chronic care management. This person can help track compliance to regulatory standards, ensuring that documentation is accurate and up to date. They also maintain oversight of the care plans, making clinical decisions when needed, and managing patient contact effectively. Every intervention, no matter how small, is logged in order to maintain clear records and support continuous quality improvements. This coordinated role helps create a reliable framework, allowing everyone involved to work efficiently toward better patient outcomes. Automated billing and reporting systems are crucial for maintaining compliance and ensuring revenue capture in your chronic care management and remote patient monitoring programs. These systems use HIPAA secure communication channels in order to protect patient privacy while handling sensitive information. Remote patient monitoring platforms collect device data automatically, allowing clinicians to monitor patients effectively without needing frequent in-person visits. When these RPM tools are integrated with electronic health records and care management software, workflows become much more streamlined, reducing the administrative burden and helping providers focus more on patient care and less on paperwork. This integration also helps ensure accurate documentation and timely billing, which supports financial sustainability and regulatory adherence. The accurate documentation is critical in order to ensure compliance. Excuse me. Accurate documentation is crucial to ensure compliance, support billing, and be prepared for any audits. It starts with getting documented consent from patients and maintaining a clear audit trail that captures every interaction. Every patient touchpoint should be logged in detail, reflecting updates to a patient's condition or care. It's important to document at least 20 minutes per month that detail the patient's care activities, showing consistent engagement. Additionally, developing an individualized care plan that is tailored to the specific needs of each patient allows for better care management and clearer communication across the care team. Now, if you wanted to run a pilot plan, this is what the first 30 days should look like. Starting with the first week, you want to focus on identifying the patient population for the pilot program, selecting those who will benefit the most and meet the criteria for monitoring. In the second week, you want to assign and clarify roles within your care team, ensuring that everyone understands their responsibilities and targets the selected patient population effectively. By week 3, patient enrollment into the program begins alongside the initiation of monitoring processes, allowing us to collect real-time data and track progress. In week 4, week 4 involves a thorough analysis of the collected data and optimization of operational workflows in order to improve patient outcomes and program efficiency. This structured, step-by-step approach helps you maintain clear roles, supports rigorous monitoring, and drives continuous improvements throughout the pilot phase. Using electronic health records data alongside risk stratification tools allows you to accurately identify and target the patient population that is most in need. Start by obtaining informed patient consent from your patient cohort, making sure they understand what the program involves, and setting clear expectations. Focus on engaging and informing patients throughout the process in order to ensure their active participation. Prioritize those patients who are high risk or frequently use healthcare services. That's because these patients stand to benefit the most from additional care management. From this group, select around 50 to 100 patients who have chronic conditions, are covered by Medicare or Medicare Advantage, excuse me, and have been seen in the clinic within the last year and are not currently enrolled in another competing chronic care management program. Participation should always be completely voluntary. This program ensures that the selected patient cohort is appropriate for focused care management and helps to optimize resource allocations for better patient outcomes. To ensure smooth operations, it's important to define clear ownership of each task in the remote patient monitoring processes. The first step involves the coordinator who initiates patient outreach, documents every intervention, and maintains communication to keep everyone aligned. Next, the clinician reviews and supervises care plans, making sure they meet medical standards and are tailored to each patient's needs. Then, the vendor or technical team, depending on if you're outsourcing or doing it internally, the vendor or technical team takes responsibility for setting up the remote patient monitoring devices and managing any alerts that come through the monitoring platform promptly. By mapping out these roles clearly, we can enhance accountability and ensure that each step is completed efficiently, which supports better patient outcomes and seamless care transition. As we implement our workflows, it's crucial to continuously monitor for any challenges or issues that arise. Keeping a detailed record of these problems helps us identify patterns and areas needing adjustments. To address this effectively, we conduct weekly interdisciplinary team reviews where members from different specialties come together to troubleshoot and refine the process. This collaborative approach ensures that solutions are comprehensive and practical. At the same time, managing patient enrollment carefully helps maintain a workload that the team can handle efficiently, typically enrolling 10 to 15 patients per week. This balance allows for consistent progress without overwhelming resources, ensuring smooth and effective workflow improvements. As we look at the progression over the 4 weeks, you can expect a clear upward trend in patient enrollment, starting with around 20% in week 1 and rising steadily to about 80% by week 4. Alongside this, the average minutes or time logged by the care team also can be expected to increase from around 10 minutes to 22 minutes, indicating a more active engagement and documentation over time. Patient satisfaction, while starting at a modest level, demonstrates a gradual improvement as well, reflecting that as more patients are enrolled and monitored, their experience is positively impacted. This data highlights how consistent effort in enrollment and documentation not only enhances operational performance, but also contributes to better patient outcomes. It underscores the importance of maintaining thorough communication and tracking to build trust and satisfaction throughout the program rollout. To maintain efficiency and ensure alignment with quality payment programs and HEDIS metrics, it's important to follow a few key practices consistently. First, conduct quarterly quality improvement reviews to regularly assess how well your processes are working and identifying areas for improvement. Alongside these reviews, generate monthly billing and performance reports to track progress and maintain transparency. Accurate documentation is equally critical. Make sure patient consent and contact time are recorded precisely to support compliance and quality tracking. These steps create a simple, repeatable workflow that keeps your team focused on measurable outcomes while enabling ongoing improvements tied directly to quality standards. To deliver better patient care while maintaining sustainable revenue, it's important to focus on processes that prioritize quality care and financial feasibility together. Maximizing reimbursement opportunities means understanding and standardizing workflows to improve both efficiency and effectiveness in your practice. Selecting the chronic care management or remote patient monitoring model that fits your practice's specific capacities and goals is going to be key. There's no one size fits all approach. Start with a manageable pilot project because this allows you to refine your approach before scaling up. Throughout, ensure that all actions comply with regulatory standards and prepare for broader implementation once the initial phase proves to be successful. This careful alignment of care quality, operational processes, and financial strategy will help your practice benefit fully from chronic care management and remote patient monitoring programs. Why consider outsourcing to a partner like Chronic Care? Well, there are several reasons. Our monthly reports are designed to meet all CMS requirements and focus on value-based care metrics, making it easier to track outcomes transparently. The implementation is quick with us and doesn't interfere with your current clinic workflows, so adopting the system feels natural and even effortless. The platform we use is fully HIPAA compliant, ensuring patient privacy is protected at all times, and it's paired with a dedicated virtual care team that provides expert support whenever needed. We manage the entire chronic care management and remote patient monitoring program from start to finish, taking care of every operational detail so your clinical team can focus on delivering excellent patient care while confidently meeting regulatory expectations. Our pharmacist-led advantage contributes to the effective medication management, which relies heavily on close collaboration between prescribers and patients. When patients receive clear education about their medication, it helps to improve their adherence, which is crucial for controlling chronic diseases more efficiently. At the same time, applying proactive strategies to prevent adverse drug events is crucial, especially since these events are a major cause of hospitalizations and emergency room visits. Managing the risk associated with polypharmacy is an important part of our effort. Pharmacists play a central role by providing expert medication reconciliation and optimization, carefully reviewing and adjusting treatment to better suit each patient's specific needs. This coordinated approach ensures safer, more personalized care and supports better patient outcomes. With us at Chronic Care, patients are encouraged to connect with community-based resources that support their overall wellness. These can include housing agencies, transportation services, food banks, and even churches, which can act as important safety nets for vulnerable populations. This approach helps build a patient's confidence in managing their own health and improves their understanding of medication use, promoting better adherence. Our self-care advocate program plays a key role by educating patients on nutrition, physical activity, and even stress management, addressing all aspects of their health. By integrating these community supports and holistic health education, we can empower patients to maintain their wellness effectively and sustainably throughout their chronic care journey. Key takeaways for this presentation. Partnering with experts who align with your mission is going to be key to reducing your risk and maximizing the value in your chronic care management program. You can choose the chronic care management and remote patient monitoring model that fits your practice best, whether that's managing it in-house, outsourcing it to specialists, or a hybrid approach that combines elements of both. It's important to start small with a pilot program because this can allow you to test and refine processes while maintaining compliance with regulations. As you gain confidence and data, you can then scale the program thoughtfully to support sustainable growth. If you have questions or want to explore options tailored to your needs, please feel free to contact me as a next step. I can offer expert guidance to help you and your practice succeed in value-based care. My name is Dr. Cedric Pachetu, founder and CEO of Chronic Care. I thank you so much for joining this presentation.